May is Skin Cancer Awareness Month, and a new survey from the American Academy of Dermatology shows a third of Americans failed a basic quiz about sun exposure. It found 42% of Gen Zers and 37% of millennials didn't know tanning causes cancer. Meanwhile, 42% of millennials are unaware the sun's UV rays can penetrate clothing. And a third of the Gen Z adults didn't know you can get a sunburn even on a cloudy day. With those alarming numbers, we want to make sure that you are protected from the sun's harmful rays. So this morning, Dr. Vanessa Johnson with Health First Medical Group in Brevard County is here to talk about skin cancer prevention. Good morning to you.
Good morning. Thank you.
So this is a topic that I think is extremely important for everyone who lives in this area because we see the sun year round and we're always outside. We're always doing things. And clearly there's a lot that we need to learn about this. So what's the first thing people should keep in mind before they head out into the sun?
So being prepared can go a long way, and taking just a few extra minutes before you spend a full day at the beach can really help you to protect yourself all day long. So I recommend grabbing a hat, grabbing some sun protective clothing, as well as a beach umbrella, and making sure your sunscreen is not expired before you head to the beach. Because even just those few extra minutes before you head outdoors can go a long way to prevent skin cancer, sun damage, and definitely sunburn.
Yeah, and I want to get to some of the sunscreen questions in just a moment because I think there are a lot of myths that you can help bust. But before we do that, can you talk to us about skin cancer? What is the most common kind?
So basal cell carcinoma is the most common type of skin cancer, and it's actually the most common type of cancer worldwide. So over 2 million Americans every year are diagnosed with basal cell. So if you do get a basal cell, you're not alone. And although it is very common, it does grow very slowly in the skin. And so we know that it keeps growing, though, until it's treated. So early detection and early screening is crucial to being able to treat it when it's small before it causes trouble down the road.
All right, Dr. Johnson, let's get into some of these myths that I think even I've been at fault believing. For people who are naturally tan, like myself, is there a different SPF level? Are we less inclined to get any sort of skin issues?
So that's a great question. So the American Academy of Dermatology recommends an SPF 30 or greater and one that's broad spectrum. So that means protecting against UVA and UVB light. And so as long as it's above a 30, it does a good job of protecting. So 30 SPF protects against 97% of the sun's harmful rays. SPF 50 protects against 98%, and then SPF 100, 99%. So it is true you get greater protection with a higher SPF, but you can see the difference between 97 and 99% is incrementally small. But it's true, even people who have more pigment in their skin should absolutely protect their skin from skin cancer and sun damage. And so people who have darker skin tones can still get skin cancer, including melanoma.
I mean, and that's a great point, too, because I think we hear so often, oh, I'm tan, so the sun doesn't affect me as much. And that's truly a myth. How often should we be reapplying sunscreen?
That's a great question because so many times this is where people go wrong. And so they have a false sense of security. I'm using an SPF 100. I'm protected all day. And unfortunately, that's not how sunscreen works. And so even an SPF of 100 still needs to be applied every 2 hours. And so whether you're wearing a 30, 50, 100, every 2 hours you need to reapply. And that goes by really quickly. So setting an alarm on your phone or a watch can really help to make sure that you can remember to reapply because reapplication is key to protecting yourself all day long.
Dr. Johnson, let's say we forget and we end up getting a sunburn. What do we do if it gets really bad?
So if you do get a sunburn, you can still make it feel a lot better. And the key is to treating it as soon as you notice it. And so taking a cool bath or shower can help to calm down the skin, and it puts that moisture back on the top of the skin. And then applying an aloe vera or soy-based moisturizer on top of that can help to lock in that moisture. So before your skin ever dries, applying the moisturizer and then trying to protect yourself from getting more sun. So sun protective clothing on a fresh sunburn can go a long way. And I recommend taking your clothing and holding it up to a bright light. If you see light coming through the clothing, it's likely not very sun protective, but more tightly woven fabrics where the light does not penetrate have a higher sun protective value. And so if you're unfortunate enough to get a blistering sunburn, I also recommend do not take the blister roof off, because the roof of the blister actually acts as a biologic dressing. It's almost like your body's own Band-Aid to help it heal faster and to make sure that you don't get an infection on top of that blister. And so additionally, staying hydrated, because sunburns do take fluid out of the body and onto the surface of the skin. So drinking lots of water can prevent dehydration with a sunburn. And if you've had lots of sunburns, please get a skin exam because, as you mentioned, it is Skin Cancer Awareness Month in May, and especially sunburns in childhood increase your risk of skin cancer, specifically melanoma. And so it's really important to get screened early.
Some really, really good tips in there, Dr. Vanessa Johnson. Thank you so much for joining us this morning and sharing some information that we could really use year-round. We appreciate it.
Absolutely. Thanks for having me.